on today's episode with Farm Guide International, I'm going to be answering a question that says, can I stop my antibiotics and start another one mid-treatment? That's, you've already started treatment and is asking me if he can stop the one he has started already and continue with another antibiotic. So welcome to today's episode. All right, so here we talk about everything medication safety and health safety generally. So let's jump right into it. There are so many reasons why one may want to change the antibiotic that they are taking mid-treatment to another antibiotic. The first one is the person could be experiencing very severe side effects, which could range from either hives, swellings, difficulty in breathing. But even in that case, it is not advisable to change on your own. In this era of do it yourself, DIY, and all of that, it does not apply when it comes to, your medications. So don't apply the do it yourself rule, you get me, right? You still need to reach out to your healthcare provider and let them know the side effects that you're experiencing. But what you can do on your own is stop the medication and visit your health professional, let them know how you're feeling, the side effects, and then they can recommend either an alternative or something better. But please don't do it yourself. Another reason why someone may want to stop their antibiotics treatment midway, they may have taken for some days and they are feeling, this medicine is not doing it for me, it's not effective, it's not working as it should, I'm not getting enough results. Still, don't change on your own. Get back to the hospital, get back to your healthcare provider, let them know how you feel, and if they see reasons to change your antibiotic, they'll do it themselves. That way you are safer. Lastly, another reason why someone may want to change the antibiotic midway is because if that medicine is actually out of stock. So that one, your healthcare provider can help you. They'll give you an alternative. It could be a brand of the same medicine. I actually did a video on brands and generic. I'll link the video here somewhere, so just click on it so you can watch and learn more about brands and generics. So those are the reasons why one may want to change their antibiotics. So now let me talk about why you should not change yourself. I've said it severally, don't change on your own, meet your healthcare provider. The reason why I say you should not change or start another antibiotic on your own mid-treatment is because, one, it can cause antibiotic resistance. Antibiotic resistance is one of the world's, biggest, one of the world's biggest health threats. I talked about it in a particular video. I'll also link that video in this particular video so you can, watch and learn all about antibiotic resistance. It can cause antibiotic resistance where, the medicines are not working. The medicines that are actually meant to kill a particular bacteria in your body are no longer effective for that, infection. It could cause a whole lot of problems. So do not change antibiotics on your own. Involve your healthcare provider, involve your pharmacist, and you'll be directed appropriately, or the change will be done appropriately. Secondly, if you go ahead to do it yourself, the DIY thingy, right, you may be choosing the wrong antibiotic, because antibiotics don't work the same way. They work in different ways, and you do not know, you do not have that information, but your health provider does. So leave the work to them, let them do what they have been trained to do. Lastly, if you do it yourself, your infection or whatever bacterial infection you're trying to treat could become worse. And I know you don't want that. So for that person that asked the question, and for some people that may have this question in their heart, please don't change to another antibiotic on your own. I understand that you may be having challenges like side effects, or you don't feel like it's working for you, or the one you started with is already out of stock. Ensure that you get back to your healthcare provider and they'll be able to help you. Then you would know if you're going to change or if you'll be given something better to use. I hope this has helped someone. Don't forget to like and subscribe, and also share to anyone that may need this information. Thank you for listening to me today. Have a great weekend. Bye.